Well, Dignity Health Mercy Hospital Southwest marking a major advancement in patient care after successfully completing its first procedure using a newly acquired robotic-assisted surgical system. Robots coming in to help you out. The expansion enhances minimally invasive surgery options across several specialties and aims to improve outcomes for patients here at home. Now, one of those specialties is with our Dr. Lawrence Malaleri, colorectal surgeon. This is great news to hear. Doctor, tell us a little bit about this new robotic-assisted surgical system that's helping you out in your field.
Thank you for having me, first of all. Good morning to everyone. So we're very lucky to be one of the first hospitals in the whole Central Valley to receive the latest robotic platform to perform surgical procedures in patients here in the community. It's called the DV5 surgical system. It's made by Intuitive Surgical, and it is the latest cutting-edge technology available to our surgical teams to be able to perform very complex abdominal surgeries.
I'm looking at the image off on the screen. You're looking into one thing, but there was this giant, one with a whole bunch of arms.
That's right. So that is basically, so as you can see on this picture over here, there's three separate parts to the system. There's the surgeon console, which you saw on the previous picture when I was kind of putting my head in and controlling the robot. The arms are actually the robotic instruments who are placed on the patient. And the surgeon controls those arms. As you can see, there's 4 of them. So it gives a lot of tools to the surgeon to be able to perform surgeries. And the machine in the middle is basically the brains of the robot that allows the surgeons to to control the robot.
You do colorectal
surgery, yes.
Surgery. How does that help you in that? What would that look like?
So basically, one of the key benefits to minimally invasive surgery is to allow patients to have these really complex, really major abdominal surgeries through small incisions in a very safe, detailed, accurate way, so they receive the benefits of that oncologic or cancer surgery without some of the drawbacks of major abdominal surgery. And one of the major drawbacks of abdominal surgery is complications. So that includes things like wound infections, hernia development, having a long recovery period, having to stay in the hospital for an extended period of time. Just to give you an example, a patient receiving an open abdominal surgery, whether it's colorectal or otherwise, oftentimes need to remain in the hospital for close to a week. If they had the same surgery through a minimally invasive surgery technique like robotic surgery, they're able to leave the hospital within 1 to 2 days. And that allows them to get back to their family sooner, they get back to their life sooner. And when it comes to cancer patients, it allows them to get to their next part of their treatment a lot sooner than they would otherwise.
Yeah, I had back surgery 25 years ago, and it was a robotic invasive procedure, which normally they would rip open your back and do a lot of different things. I was back at work in 2 days. It was so quick. And I was told, I was at a place in my life I was told I'd never walk again. So to have that actually happen was incredible. For you as a doctor, what does that look like then for you? You'd have to learn how to use this robotic tool, right?
Yeah, so that's the other key part of this, because having the technology, again, at the end of the day, is just a tool. You do have to have the knowledge and the experience and the training to be able to use this tool. And thankfully, at the new Southwest Star, the Thomas M. Hart Southwest Star that was recently built, we have the SACAM Company's Robotic Surgical Center, which is an accredited center of excellence in robotic surgery. We have 5 accreditations in robotic surgery at the center, which basically goes to show you and to give the community the knowledge and the comfort that this tool is used appropriately and safely by surgeons and staff who are not only trained, but they are being constantly evaluated by outside companies in order to prove the performance that we want to achieve. And this Center of Excellence accreditation is provided by a company called SRC, which is Surgical Review Corporation, which is a third-party a reviewer of programs in robotic surgery to make sure that they are not only used appropriately and safely, but they have the outcomes that are basically at the national recognized level. World-class surgical care, basically.
Wow. What are the other procedures they can work on? You have colorectal, but what else can it do?
Colorectal, basically any surgical procedure that requires surgeons to enter the abdominal cavity to perform. So general surgeries, hernias, for example, gallbladder removal, surgery in other parts of the belly or intestines, stomach surgery. If someone has, like, for example, a hiatal hernia, that can be fixed robotically as well. Kidney surgery, urology. We also have GYN specialists at our facility, and also GYN oncologists, so cancer patients who have cancers in the uterus or ovaries can be helped and managed by trained surgeons within the system. And we have these surgeons here in our community. We're very lucky to have that as well, actually.
I'm curious, since you've had this now, how has the first patient you worked on, how did that go?
The first patient is doing great. He's actually going home today, less than 48 hours after surgery, and he went very, very well. We're very excited to have the tool. He was very happy to be able to get out and walk on his own pretty much the day of surgery, and have almost no pain after the surgery, which was quite amazing.
Awesome. Well, Mercy Southwest is where it's going to be at. It's where you're able to work on that. And I hope people are able to use it. I hope there's more doctors like you are able to jump on it, willing to jump on it and learn, and make sure it's even easier for these patients that have to go through this.
Absolutely. And like I said, we are very lucky to have quite a few surgeons in different specialties who have the training and the accreditation needed to be able to use this tool to help our patients and our community.
Dr. Lawrence Malalari, I hope I got that last name right.
You got it.
Thank you so much for coming on this morning, and good luck to your next patient. I hope all goes well.
Thank you so much. Thanks for having me.
Absolutely.
Hi, I'm Rochelle Murcia with Eyewitness News Bakersfield Now on YouTube. Thank you for checking out our YouTube channel, where we have tons of great content to choose from. While you're here, go ahead and click on the subscribe button right there. That way you can stay up to date on all the things related within Kern County. Thanks for watching.